Antibiotics are a class of drugs used to treat bacterial infections. They work by killing or inhibiting the growth of bacteria. Antibiotic includes penicillin, cephalosporins, macrolides or tetracyclines. Antibiotic resistance is a growing public health concern in which bacteria become resistant to the drugs used to treat infections. Antibiotic resistance can occur naturally over time, but the overuse and misuse of antibiotics has accelerated the process. When antibiotics are used to treat bacterial infections, they kill the susceptible bacteria, but some bacteria may survive due to mutations or the acquisition of resistant genes from other bacteria. These resistant bacteria then multiply and pass on their resistance genes to their offspring, creating a population of bacteria that is resistant to antibiotics. The overuse and misuse of antibiotics contribute to the development of antibiotic resistance by creating a selective pressure that favors the growth of resistant bacteria. This can occur when antibiotics are prescribed unnecessarily or when patients do not complete a full course of antibiotics, allowing some bacteria to survive and become resistant. Also, the use of antibiotics in agriculture and livestock production has contributed to the development of antibiotic resistance by exposing bacteria to antibiotics in the environment. The development of antibiotic resistance is a complex process that involves the interaction between bacteria, antibiotics, and the environment. Here are some tips to help prevent antibiotic resistance. Only take antibiotics when they are prescribed by a healthcare professional and take them exactly as prescribed. Do not share antibiotics with others or save leftover antibiotics for future use. Do not demand antibiotics for viral infections like the common cold or the flu. Antibiotics are only effective against bacterial infections, and overuse of antibiotics can contribute to the development of antibiotic-resistant bacteria. Practice good hygiene, such as washing your hands frequently, covering your mouth and nose when coughing or sneezing, and avoiding close contact with sick people. This can help prevent the spread of infections and reduce the need for antibiotics. Get vaccinated against infections like the flu and pneumonia, which can reduce the need for antibiotics to treat complications. Use antibiotics only when necessary in agriculture and livestock production, as the overuse of antibiotics in these industries can contribute to the development of antibiotic-resistant bacteria. By following these tips, we can all do our part to help prevent the development and spread of antibiotic-resistant bacteria and protect the effectiveness of antibiotics for future generations.